And without further delay, I'd like to introduce our main session. And our main presenter will be Dr. Sheila Vijay Singh. And her topic will be on perimenopause, menopause, knowing and owning your change. Sheila is a family physician at St. Michael's Hospital, as well as a medical director of primary care outreach at Women's College Hospital. It is my pleasure to introduce you and to start our main session.
Good evening, everyone, and thank you for being here with us tonight. It is an absolute privilege to be speaking to you at the Best Health for Black Women Summit, and I'm thrilled to be talking about perimenopause and menopause, one of my favorite topics to talk about these days. So whether you're joining us after a busy workday or you're between caregiving tasks or taking a quiet moment just for yourself, I'm so grateful that you've carved out this time to be with us tonight. Many of you are professionals, you're caregivers, you're leaders in your communities, and you show up for your families and your workplaces and your loved ones every single day. But this moment right now, this is for you. This is about your body, it's about your health, and about your right to be informed to get the care that you deserve. Menopause is a time that affects us all personally in some way, whether it's your own journey that you're navigating or a journey of a loved one that you've witnessed. This is a photo of my mom and I. My mom, I remember very distinctly when she went through menopause, and I remember her having hot flashes and night sweats and struggling to sleep. And when I would talk to her about it and ask her if she was okay, she would tell me she was fine. And she would say, this is a normal part of aging. It's just a normal thing. And it really made me sad to see that. And I think many of you have probably experienced similar in your own lives, seeing your loved ones go through this and saying, this is just part of life. We have to just get through it. We don't have to just get through it. There are options of support and things that we can do to give you that will help you through this time. And suffering is not necessary. And I wish that was available to my mom back then. But I know now that it's available to all of us. Menopause is having a moment right now. Everybody's talking about it. Celebrities, influencers, there's TikToks, there's magazine articles. Oprah just had a special on it. There's so much information out there, which I think is incredible. It's also important to know that not all that information is accurate. And that's why we're here tonight, to make sure that you are getting evidence-based information to make the right decision for yourself. And this is especially important as Black women who are navigating a healthcare system that hasn't always served you. So let's start from the beginning. What is menopause? Menopause is a normal part of life. It is not a disease. It happens to everyone who's born with ovaries who lives long enough. The average age of menopause in Canada is 51. And there are 3 phases that I want to describe and share with you about menopause transition. There's perimenopause, which is the time that leads up to menopause, and that can be about 4 to 10 years in length. And it can start in your mid to late 30s. Generally, it starts in your 40s, and it's often described as a time of a roller coaster of hormones that can really start. You can start to see symptoms of change. Menopause itself is when you've gone 1 year without having a period. It is 1 day. It is a 1 day after you've gone 1 year without a period. After that point, you are in postmenopause for the rest of your life. What happens in menopause is that your ovaries slow down and they stop producing estrogen, and that decline can affect every part of your body. Generally, that decline is very gradual, but for people who go through surgical menopause, meaning that you've had a hysterectomy or your ovaries removed, you may go through a menopause overnight, and you may have more significant symptoms as a result. And those who go through chemotherapy or take medications that might stop ovarian function, that also can result in menopause-like symptoms as well. It's also important to note that for Black women, and why we're here tonight, is that Black women often go through menopause earlier and may have more intense symptoms, and there are options to support you. The symptoms of menopause are varied. There's over 30 to 40 symptoms of menopause, and many of my patients will check every box when they go through it. Some people don't have any symptoms, some people have a few, some people have many. Because estrogen plays a role in almost every part of the body, when levels drop, you can have a variety of symptoms that can show up. So there's many that are listed here, but some symptoms are not listed here, like palpitations and ear ringing. There's a number of other symptoms that are vague that might also be perimenopause or menopause related. Some symptoms are subtle and others are life disrupting or life changing. And all of them are real, and all of them should be addressed if they're affecting you. Menopause Foundation of Canada did a really interesting 2 hallmark studies over the last few years looking at how people navigate menopause in Canada. And what they found was that 96% of women experienced menopausal symptoms. 1 in 2 women said that menopause affected their job. 1 in 10 stated that it caused them to leave their job, reduce their hours due to menopause, and 1 in 4 shared that it affected their relationships. So it's really clear and important that we understand that certainly there are symptoms of menopause that we may have, but it also can affect our careers, it can affect our relationships with others, and our relationship with ourselves. Let's talk a little bit about Black women's experiences in menopause. And this is an important piece that came from research called the SWAN study in the United States, which looked at differences between different ethnicities and how they navigated and experienced menopause. First off, we noted, as I mentioned earlier, Black women enter menopause about 8.5 months earlier than white women on average. So there's an earlier onset of menopause. They also noted that Black women experience worse symptoms of menopause. They had more frequent and more intense hot flashes with symptoms that could last more than 10 years. The average time frame of hot flashes in the general population is 4 to 7 years, and so this is a significant difference. It was also noted to have Black women are noted to have a higher risk of chronic diseases. The menopause transition is linked to an increased risk of heart disease risk factors like high blood pressure, cholesterol, and diabetes, and these are conditions that disproportionately affect our Black patients as well. One of the key findings that happened, which is really upsetting, is that despite seeking out care, often Black women faced delayed diagnoses and treatment. And when they were diagnosed appropriately, they were less likely to be offered hormone therapy and supports. This is unacceptable, and there are things that we can do to change this. Understandably, there's medical mistrust with our system. We have a system that does not care for everyone in the same way. There is anti-Black racism, and as a result, people do not feel comfortable seeking out support. We need to change that as well by making changes within the healthcare system and understanding where our biases sit and addressing racism directly. As a result of this, many feel unheard, dismissed, and inadequately treated, and we need to address that. These disparities are not just statistics. They are real, they are painful, and they represent real lived experiences. And they're also why we must advocate for and demand equitable access to care. And this is what Women's College is also very committed to making change in as we move forward in our menopause journey with you. When I talk about menopause treatment and advocating for ourselves, I think I always share about what options are available so my patients are informed and know how to advocate for themselves when they're in healthcare settings. So first off, when we talk about hormone therapy treatments, I want to share about menopause hormone therapy, which is the artist formerly known as HRT. And this is because, often we use the term HRT, hormone replacement therapy, but the new term is menopause hormone therapy because we're not replacing your hormones to your 20, 30-year-old hormone levels. We are treating to your symptoms specifically and using whatever low dose that's needed to treat symptoms. When I talk to my patients about hormone therapy options, we go through their own personal health histories, their family histories, and understanding what their goals of care are based on what their symptoms are and how they're affecting their lives. So when we talk about hormone therapy, there are specific reasons why we do use it. Specifically, we use it for symptom relief, like symptom relief of hot flashes and night sweats and sleep issues. We also use hormone therapy for vaginal and bladder symptoms, a condition called genitourinary syndrome of menopause, which is undertreated because it's under-discussed and we don't address it. And this is something that really benefits from treatment. We also use hormone therapy to protect our long-term health. We know that estrogen has a protective effect on our bone density. It also has a protective effect on our heart health. And these are reasons why we may consider this as well. And finally, we consider hormone therapy. The average age of menopause is 51, but for folks who go through menopause early or prematurely, so under the age of 40, we want to suggest that you consider hormone therapy because estrogen during that time is not there, and estrogen has a protective effect. And so if you're going through menopause earlier, having treatment until the average age of menopause at 51 is recommended. There are many different types of hormone therapy. Very briefly, there's systemic hormonal therapy, which treats whole body symptoms. It comes in the form of skin-absorbed treatment options like the patch or the gel, or orally, you can take a pill for this. It is generally considered to be very safe for the majority of people if it started within 10 years of menopause or under the age of 60. Local estrogen therapy is the other type of hormonal therapy. It comes in the form of vaginal cream, tablets, and suppositories. It treats the genitourinary syndrome of menopause or bladder and vaginal symptoms like vaginal dryness, discomfort, and pain, and recurrent bladder infections. It is very low dose and very safe to use for long-term use. You can start it at any age, which is different than systemic or whole body hormonal therapy. I started in my 60, 70, 80-year-old patient, especially if they have bladder symptoms and recurrent UTIs. You treat the symptoms properly and they don't have to use antibiotics anymore. And this is a really important thing to consider. And when I start hormonal therapy in the form of local estrogen therapy for my patients, I tell them this is something that I suggest that you stay on till death do you part. Because if we stop using it, we see the reversal of the positive beneficial changes on the vagina and the bladder. When I talk about hormonal therapy, we have to always talk about the risks of hormonal therapy. This is specifically risks of systemic, so full body hormonal therapy. And breast cancer risk, for those who are not on hormonal therapy, the risk is about 1 in 100 women will develop breast cancer. Those who take hormonal therapy combined, which is estrogen and progesterone, well, 1 in 3 in 100 women will develop breast cancer after using hormonal therapy for 4 to 5 years. This is equivalent in risk to about a glass of wine a day. There's an increased risk of blood clots and stroke, slightly with estrogen-containing products, more of a risk with the pill form over the skin-absorbed forms of the patch and the gel. Also, when talking about options for treatment, we have to talk about non-hormonal treatment options. If you cannot take hormones or don't want to take hormone therapy, there are other options available for you to help treat some of the symptoms. So there's antidepressant medications that can help with hot flashes or mood swings. Gabapentin can help with reducing hot flashes. And there's a new non-hormonal treatment option that's just become available in Canada that is a non-hormonal option that's very effective as well. There's also evidence for therapeutic support in the form of cognitive behavioral therapy. Especially good is cognitive behavioral therapy for insomnia. That's great for mood, sleep, and anxiety. And also mindfulness and meditation can help to reduce stress and help with your symptoms. Always talk about lifestyle changes as well. Some people don't want to take medication, and that is okay. That is your right. But there are options that might help you in terms of things that you can do at home. So I always start with dietary changes to consider. There's so many things that we grew up with in our diet and culturally that are important to us. I don't want to take those away. I think it's important that we add the things and just make sure that you're getting enough of other things that we know will be helpful for you in midlife and beyond. So specifically, we want to make sure that you have sufficient calcium and vitamin D to protect your bone health. We also want to suggest fiber for you. 30 grams a day of fiber is really important. It helps with cholesterol levels. It helps you feel full and helps your bowel movements. And protein is also really important because we lose muscle mass as we get older. So here's the requirements and suggested requirements that might be helpful for you to help you maintain your muscle mass. Moving our bodies is also important. And I know this can be difficult if you're not feeling well. So sometimes we have to start with treatment first before we can get you up and going. But if you can, moving 150 minutes a week, separated throughout the week to bite-sized chunks can be really helpful, specifically moderate cardiovascular exercise. And I always suggest to my patients, do something that you love, whether it's walking, dancing, cycling. You're more likely to continue that if that's something that you enjoy doing. Strength training is really important, not something that we don't do enough of. Strength training 2 to 3 times a week keeps your bones and your muscles strong, not only for today, but also for your future self as well. And small steps make big differences here. So starting small and building is a really excellent way to start. It's important to think about your menopause care team. You're not meant to do this alone. I've listed a number of healthcare providers who are excellent. They provide different levels of support based on their expertise that are really important to be part of this. They should feel safe and understand where you're coming from and be judgment-free. And the most important part of your team that I included here is your care community. So your friends, your family, your loved ones, a circle of support. Social connection is really important during midlife and beyond. And we know that helps people survive longer if you have social connections. So that's the most important part of your care team as well. Here are a couple of resources that are really helpful. There's great podcasts to listen to if you're a podcaster, if you enjoy that. There's also evidence-based information on these websites that we can share in the resources. So I want to thank you all for being here and being a part of this important event. Menopause is a natural transition. It is not a disease, and it is not something that we have to suffer through. Black women experience unique challenges, and our healthcare system must be responsive, acknowledge where we have anti-Black racism, and offer equitable access and high-quality care to our patients. You deserve access to quality treatment and support, and we are here to support you here at Women's College Hospital. So please, let's advocate for ourselves, your sisters, your mothers, and your community. And I think that often we think about menopause as a very difficult time, something to be worried about, but I also see that it is a time of wisdom. It is a time where you are coming into yourself and really owning this space. And it is a time that we can thrive. And so let's shift that narrative from suffering through this time and just enduring it to thriving during this time, because this is just the beginning of the next chapter of your lives where we can be healthy, happy, and well together. Thank you.